Hello and welcome to another program on COVID-19, the good, bad, and the ugly. Now, today I'm going to take it to a different level. That is a very important level. That's what I'm doing here, sharing information or dissemination of information. Now, in the health industry or the health sector, it's very important at this point as to what information is communicated and you and I, what information we get and what information we access to. So to talk about this, there's nobody better than somebody who's managing that information part. So my guest today is Dr. Anil Samaranayak, a consultant community physician and senior health administrator. He is now the Director of Health Information at the Ministry of Health. Anil, thank you very much for joining us in this early morning with your busy schedule. I know all health administrators, health people are very important these days. Not that you're not important other times, but very important, very busy. Thank you for joining us. How are you today?
Thank you, Ajay. Thank you. So it's fine. We are busy as usual, but information is very important. So
yes. Now, Anil, as you know, especially in this COVID-19 scenario, there's a lot of information going around about the COVID virus itself and what to do, what not to do, and all that. And if you really look at it, I mean, I was telling people that if you ask the COVID virus, we know more, we seems to know more than the about the COVID virus, more than the virus itself. The virus would say, I don't know this much about me. You know, it is that much of information. But my point is, not all this information is true and correct. So first of all, as Director of Health Information, tell us, what and where should we look for to get the correct information in this COVID-19 coronavirus period?
I do totally agree. It's more than information. You can see a lot of misinformation. That is very important that we have the discussion, and we initiated it. That is very vital at this moment. As you can see, during this social media and all, it is we are in an ocean of misinformation, but there are islands of information. That's what the question. So that is why in the Ministry of Health, even among us, we have many different units. You can see we have a very beautiful aligned agreement with who gives the information. So in the under the Ministry of Health is the epidemiological unit who's handling. They are mainly responsible, and they are the people. They are the institution that give out numbers and figures on COVID situation. So there's no other section will talk about the numbers. Other thing is health promotion. The Health Promotion Bureau in the Ministry of Health, they only produce the health promotion. We have come to an agreement. We will not, the units that we have the capacity, but we will not produce any health promotion messages, because however we try to do accurate, when there's room for accuracy and misinformation. So only the Health Promotion Bureau is totally managing with the production of promotional messages and that kind of material. So like that, and there's a disaster management unit in the Ministry of Health. So the disaster management unit working on that. Actually, in the sense, all the units, medical services unit, and there are many innumerable units working in the Ministry of Health. But in case of information, we have taken, our Director General has taken the very restrictive measures to address this issue of going out misinformation. So I think we are that is why you can see on the Director General of Health Services, the head of the epidemiology unit, and the Honorable Minister of Health only communicating with the public most of the time officially. So people know that's very vital. Even a lot of public ask me that you all are handling it very well, doctor, they said, because there's only one message goes per day, the numbers, because there's no confusion. We have taken very restrictive measures to address this. But still, as you see, we are living in the era of information, and can I call it, we are living in the era of misinformation? Because I can remember very well, there were so many epidemics. In 2012, there was SARS and influenza, but that social media was not there. But I don't know. Social media is a very positive thing, but it is like we should take measures like this to get the maximum use of it. Really, we are doing it. Really, I think as Sri Lanka, we are doing very well using this communication technology.
Yeah. So congratulations and thank you for that, all those communications. But before I go further, you mentioned about 3, 4 institutions. Can you mention like a website or a telephone number for them so that our public can get to know?
We always advise all the information we upload in the Ministry of Health website.
Ministry
So
of
it's
Health
very
website.
easy.
Okay.
Ministry of Health
Mhm.
website. All the rest of the institutions are linked. And we have, if you go to the homepage of our Ministry of Health, it is maintained by my unit.
Mhm.
It's totally on this current figures and raising important public and public messages all uncovered.
Mhm.
So everything is at a glance you can see all your required information, phone numbers, and but even about what we are going to discuss about now, the apps and all that they are on the Ministry of Health website. It is maintained and maintained by Health Information Unit under me.
Right. So thank you very much for that. That is very, very good. We have one source we can get all the information. Now, as you can see, I'm doing a television program from home, uh, practicing the working at home principle and physical distancing, as we now call it, more than social distancing. So I believe if I can do that, there could be other professions also that can adopt at least to a certain extent, working from home. So my question to you is, how do we use this telecommunication or communication per se, um, to uh, for people to consult doctors? Because we saw in the news that there is some kind of a thing going around that people can do consult doctors from home. Is it 100% working now, and or how is it working in Sri Lanka?
We initiated it in our
Okay.
unit because there's a concept of telemedicine has been there for many decades.
Ah.
Because if you describe, the definition is that the doctor and the patient are not physically, they are not at the same place, but still the consultation can go on. So I think this particular incident of this pandemic has bring us to a situation where we have no choice because we need to be distanced. So doctor and patient, it is been distance now. So but still we don't give up. So the answer is will be telemedicine. So it is very important because now the microorganism itself has asked the patient not to go to the doctor. If you take the virus has put that to the patient. If you go to the doctor, doctor also going to get infected. So in that kind of situation, we use the concept of telemedicine, where you can use the most information. It may not be 100% as you can use doctor-patient contact. You do the physical examination, and many are starting with feeling the pulse, and there are many elements. But still, in a compared to the circumstance, we can do a near perfect job by telemedicine. So for that, as you know, we all the government institutions, and now we have to work with these ICTA, with the agency, government agency. So instead of that, we were lucky that we have been working with them for many years and very closely. And there's some even the chairman of ICTA and the board members, particularly one very world level scientist, one Sanjeev Veerwara. He was working, has been working with us for a long time, even before this pandemic started. So we thought that this is the ideal time to use this concept of telemedicine. So we developed. We have doctors in my unit who has specialized in bioinformatics, health informatics. I think that is also I should mention. Other than USA, we are the only country. The Ministry of Health has only doctors specializing in this health informatics field of health informatics. So I have very capable group of doctors. With ICTA, they developed this app. We call it My Health. My Health app, and even this is the time, as you can see, a lot of private sector also come into the picture, and they are it's very positive thing. They all collaborate with us, and we came out with this app of My Health. So as you can see, for many weeks, this tele consultation has been going on. There are many hotlines that people can give to. We really actively encourage them to now, if you have symptoms, signs, suspecting symptoms of this COVID or any other respiratory infection, but we encourage people to not to go advance to a doctor. So you use a telephone line, and it has been going on for some time now. From yesterday, even His Excellency's Facebook page, you can see it was there posted yesterday. So it has been because ICTA comes directly under Excellency, and we are working very closely and came out with this app of My Health. So there are millions of people with smartphones, and they invariably use apps for many different reasons, mainly for entertainment and social media. So now use it for your health and keep the distance. And this is much better, I think, than calling, and you can see the doctor. You have trust, and the doctor even can see, at least to some extent, see the situation in many symptoms you can see on a patient. So in a tele encounter, you can see the patient. The visual factor also can contribute. So this My Health app is that it's a collaborative act between Ministry of Health, Health Information Unit, and the Health Promotion Bureau and the epidemiology. We all are, as I said initially, in all measures we work together. So no compartmentalization. So working with ICTA, we have launched this app. So people who as you know, it's in the Google.
So where can we download it, both as Apple and Android both?
Yes, it's Google Play Store.
All right.
It's free available.
Right. So now you said there's a collaboration. So does this mean any doctor in any hospital I was to go and see, I don't want to mention brand, there are so many brands of hospitals in Sri Lanka, it is connected to any doctor coming to any private hospital or government hospital, I can connect with this app. Is that what you're saying?
You are talking about future.
We're talking future.
Today.
Yeah.
Yes.
Today it will be.
I will say yes.
Tomorrow it will be.
Yes. I will say yes. Yes. Future.
Okay. For the moment, what can we do?
For the moment, there are volunteers because we are working together with this element. So at the beginning, we have nearly 150 doctors. It is not what you used to go or anything. It's been automatically distributed, equally distributed to a particular doctor when you make a go to the app. So it is by the system you are assigned to a doctor. Definitely, it may not be the doctor you use.
But in the future, you are going there.
This is not really what actually I will use this pandemic as a pedestal. So in future, this is the future. So in many in the future, doctor will decide whether you need to come and see him physically or not.
So let me very good. So we are saving parking space. We are parking this thing. We are saving having to get dressed, having to take all those reports and what missing reports, and then going traveling 2-3 hours and so much of the expenses. But in the future, as you say, you're going to develop it to you can channel any doctor. Then how is the payment going to be to make to the doctor?
Yeah, those things will
develop through the app itself.
Exactly. Even now, even now in the private sector, it is going on to some extent because you can channel at least.
You can channel,
channel it out. So that can be addressed.
Yeah. So basically, for nothing you need to go. You just pay up and schedule.
Doctor will decide. Doctor will decide
whether you need to come. So on a typical case, if you just like first time consulting, generally when you go to a doctor checks the pressure and keep the stethoscope and check and all that. How is that going to work?
Yeah, it's the changing world, as you can remember. When we were students, there was one blood pressure meter, maybe one more. So I can remember it was so. So the nurse has to bring it to us when we do the water. Now, if you go to a household with literate people, there are blood pressure meters in their homes. And if I quote a private example, in my home, my father-in-law is a retired government servant. He was checking his own blood sugar and his blood pressure all the time. So we are now living in a different world. I think in future, yes, doctor will decide. Measuring your own pressure may not be accurate as doctor. Maybe in different situations, doctor may need to check it. But yeah, that is we are moving towards that time. So in tele because in some countries this has been all in practice. So I think that is the vision we have. So it may not. As you know, there are no single solutions in the world. So many elements we may have to develop, and this is the beginning. That's what I said. We have been asked to be distanced. So then we have to find a solution. So this is the solution that I think this uh, uh, even after this pandemic, we are going to definitely win over this. And as yesterday, your discussion with the WHO representative, and she said if there's a country to do well in this situation, we will do. So we are proud to be part of it in that
Yeah.
team. And so I think now we are thinking beyond that. So that this telemedicine and probably is going to be the reality.
Anil, there's a thing called teletriage at Cancer Hospital, Maharagama, right? Can you explain a little bit about this? What is this all about?
Yeah, that is again one of the initiatives from one of our doctors. He's one of the most senior health informatic doctors working in the cancer hospital, and so that, as you know now it is when suspected patient come for a place like cancer hospital, you know that they are already diagnosed, but still they also can develop this COVID symptoms. So before they get into a physical contact, so they have arranged a room. That's a very good initiative that where patient will go in, but everything is recorded and cameras are set. So the doctor from a distance can get the disease and again telemedicine and a more little bit of more closer in a different room, next room, but you are not physically you have to keep this 1 meter distance. So a few meter distance, the patient will come to a room and he will she will describe the symptoms and the doctor can take a decision before coming into contact and come close to the patient. So they have already started. So this is not only to that place, and in all the hospitals we can do it. And this certain places like Anandpura, they have already done it. So it is a great thing that you can see even inside places like Homagama Hospital and few others. Some robots also working. So the technology has been used. So I think as like any dark clouds, there's a silver line. So this technology will be the silver line of this I think pandemic, because as we know very well in this World War One, World War Two, after that there was kind of a leap of development. True, after some casualties. So in the same way, so I think in this the communication technology will leap forward in this pandemic, because whether we like it or not, we have to use it. So we are in a situation like this. So especially that's I think we should be thankful to the pioneers who started this. Doctors themselves becoming the health informatics experts. So I'm the head of them. Though I'm a public health specialist now, I am as I'm holding this post. So they are doing very silently. They are taken many initiatives now, and this is My Health app is one of them that we have done in collaboration.
Any last thoughts you'd like to leave us with us before we conclude? Any last thoughts?
Yes,
Advice to the
yes,
public?
and it's a great thing, like media, and it's I've never seen in my lifetime the people they do what can do everybody. I mean, it's a very positive thing. This is you will love Sri Lankan society. All whatever we see negative, they have overcome all of that, and everybody is trying to do what they can do. It's a very positive thing, as we can be proud of as a nation. And I think, as everyone says, we are going to do remarkably well. This is my wish, and I sincerely wish so.
Dr. Anil Samaranayake, Director of Health Information of Ministry of Health, Consultant Community Vision and Senior Health Administrator. Thank you very much for joining us and clarifying us with all those information. And we wish you, success, luck, and success in your projects. And stay safe. And thank you again on behalf of all of us. Thank you again for doing this. Your health sector people doing this massive service for Sri Lanka in this COVID-19. Thank you for joining us.